Welcome to another episode of the NHS Navigator podcast, the place where we uncover real journeys, silent challenges, and victories of doctors making their way through the NHS, especially our overseas doctors, colleagues who step into a whole new world of medicine and culture. Today, I'm truly honored to welcome a remarkable guest, Dr. Sood, a pediatric consultant with well over 2 decades of experience in the NHS. He's known not just only for his clinical excellence and gentle presence, but also for his deep care for junior doctors and overseas doctors especially. He is what we often call a gentleman doctor, a trusted mentor who leads with kindness, wisdom, and quiet strength. And where clinical attachments become harder to secure, Dr. Sood never stopped helping. He continued to create opportunities, offer guidance, and share insights that only 2 decades of service can truly provide. So if you've ever felt unsure, overwhelmed, or isolated as a new doctor in the NHS, this episode is for you. Dr. Sood's story and the lessons he shares will help you not just survive, but thrive in the NHS. So let's dive in. Welcome, Dr. Sood, to the podcast.
Thank you very much for inviting me.
Well, thank you for making the time. Really appreciate that. So I'm going to ask you a couple of questions and aiming at helping overseas doctors understand the system, know how to navigate, and also understand how to do things better than what they're doing right now. And I'm sure with your wisdom and experience, we will help them to get this done in the first time. So can I ask you, Dr. Sood, to take us back to when you first arrived in the UK and NHS and tell us what were your biggest struggles and what helped you push through?
I am a foreign medical graduate. So I graduated my primary degree in India. And then I went for a short sprint to Saudi Arabia. And then, of course, from there, I came into the UK. I came through the route of Royal College of Paediatrics mentorship and sponsorship. So I didn't have to give my PLAB examination. So when I came here, I'd already done several years in pediatrics. But then I joined as a senior house officer in pediatrics. Working at that time in the NHS was very different than what it is today. At that time, the working hours were just like India or America, where you arrive on the ward before your consultant has even brushed his teeth. And then you left at night, when your patients have slept.
Wow.
And England was same. The whole UK was same. We worked up to 90 hours a week. There was non-stop work and it was very, very difficult. And then we have to study. And then we had our families. We have to look after children, get them back from the school, do things. And if your husband and wife are working, the life was very difficult. But I must say, then when we joined European Union, everything changed. So there were fixed working hours. We couldn't work more than that. We had to have breaks and have coffee. But sadly, I had become a consultant by that time. So I didn't enjoy that. But
too late.
It was very different working then and very different working now.
Amazing. And thank you for taking us through your journey. It sounds like there have been so many changes along the line since you first joined the NHS. Right. And thanks for sharing this, by the way. So along your way as a consultant, I'm sure you've mentored many overseas doctors. But I want to ask you, what was the most common mistakes overseas doctors make? And how could you give them a guidance on how to avoid doing these mistakes?
Just remember something. First of all, the sheer numbers. At that time, the numbers was less for the foreign medical graduates. Now you are many. And we are looking very quickly through your CVs and through your personality. We are not looking for very, very intelligent doctors. We are looking for smart doctors. We are looking for caring doctors. We are looking for truthful doctors who can speak good English, who can not only make a child smile, but also remember you have to have a whole family with you. So I can tell you more about pediatrics. It's not patient to doctor relationship, it's whole family relationship. So when we look at you guys, when you come over, we are looking somebody who has got a sense of humor, who wants to work hard, wants to learn, and has a very good interpersonal relationship, not only with the consultants, with your own colleagues, with your secretaries, with the nurses, with the admin staff, with the receptionist, with the cleaner, Because what happens is at the end of the day, everyone talks to each other. So you have to have an overall good impression of everybody. And then, of course, your sincerity to work. And that's a road to success.
Amazing, amazing. It sounds like you're talking about a super doctor who's got ability to become a good doctor with good doctor knowledge, as well as good communicator, and manage to manage the whole scene, which is a, don't you think it's a big ask for overseas doctors?
It is not, rather, it's a very little ask.
Okay.
Medical knowledge you will gain while you're working. So you will learn enough, you will give your exams, and you will pass your membership exams, and you will be through there in no time. Rest, everything else, what I'm asking is of a good human being. A person who laughs, a person who jokes, a person who's got good relationships with each other, a person who wants to work hard on the job. We're not asking you to work long hours because hours are fixed now. So you would not be able to work all day, all night. It doesn't happen anymore. So it's a very simple ask. Be smart, be on your feet, and learn from others.
Right. And this will bring me to another question, which is, I'm glad we discussed this topic. So when overseas doctors come from an overseas country, whether it's India, Pakistan, Egypt, or whatever in the world, they have their own culture and their own way of doing things. So when they come to the UK, without having mentorship, how are they supposed to bridge the gap? And how are they supposed to deliver what you're asking for them to deliver right now?
It's a very important question. I'll give you my example. Several years ago from Saudi Arabia, I went to Ireland. I wanted to do my diploma in childhood DCH there. So I did 1 month attachment in the Temple Street Hospital. And, then after that, I attended my course and gave the exam. And of course, I passed. But I want to tell you about little incidents. I was standing with the A&E consultant once in the A&E. He was just relaxed, back on his wall, and he asked me, Rajiv, can you tell me a differential diagnosis of a limping child? Of course, I read the book like anything. I gave all the rarer things, osteosarcoma, malignancy, this, septic arthritis, and whatnot. I rattled on and on and on because I know in India, if I write 2 pages on it, I will get maximum marks.
Sure.
So he didn't interrupt me. He let me speak, kept a slight smile on his face. And when I finished after 5 minutes of, telling everything in the book, he looked at me, smiled and said, what about thorn to the foot? And that changed my pediatrics. This is what pediatrics we are expecting. Just common sense pediatrics. We are not making rarer diagnosis. It will come. But we are making simple diagnosis. So don't worry about your knowledge. It will come. So this is not a daunting task, but pediatrics is simple. It's bread and butter pediatrics, what you learn every day on the ward and on the floor.
Thank you for elaborating on this, which I'm going to dig deep even further on this, because I have been talking to many overseas doctors right now. And whenever I talk to them, they always say one thing: we struggle with the culture. And the second thing they always say is they don't understand how to do things in the right way. And the reason I'm probing on this question again is because they're not having enough mentorship. So the NHS has changed, has developed. You got the NHS England, now it's been abolished, but they haven't done anything for overseas doctors. Do you think the NHS is providing anything to support these doctors?
There is enough support. First of all, to break into the system, I think a clinical attachment is necessary. I think so that you need to know. And if you apply to various hospitals, they would reply back. And usually, I think minimum you should do 4 weeks of clinical attachment, but you could do longer. When you do clinical attachment, you are under the mentorship of a consultant who will introduce you to the whole unit and then tell one of the registrars or SHOs to work alongside, you will work alongside them. Of course, you will learn, you will see how people talk. The talking to the parents and the children is very different than in our countries. Doctor is a god. So somehow parents, families slightly fear them. But here we are friends. So we gel very easily. We play with the children. We are friends to the parents. So it's very different. Now, mentorship is very, very important. So when you sit every week, with your consultant, he will guide you through what you did right, what you did wrong, how to write legibly, how to take a history, how to present your findings is very important. It's not important talking to the parents and writing it down. In the morning, when we are presenting 20 patients, you should present something and not take more than 3 to 5 minutes to tell, what you think about it and what are your recommendations. Then talking to other people, you will start learning, what they speak. Means my first job was in Yorkshire. I have, studied always in the English medium from public schools in India. I thought, my mother was a professor in English, but I couldn't understand a single word. When they laughed, I laughed because I didn't know what the joke was. They called, tea dinner. I didn't know. I thought tea is a cup of tea, which you have in the evening. So cultural things are there, but these you will only learn when your feet are on the ground and you're mixing with the population.
Communicating.
Some cities are very diverse. There you will meet all kind of nationalities, and you will see that from English to other ethnicities, they all talk differently. But some cities you will find, they're mainly English-speaking people. But don't get scared, because under the NHS there is enough diversity. Everyone gives respect to everybody. So don't get daunted. Just gel in, talk to people, and you will pick up things.
Thank you for this insightful advice, really. Really appreciate that. I think everyone will appreciate this advice, because actually it is this sort of gelling in which they need to understand as well, because many people will come from different parts of the world and they will mix with their own communities, which is not bad. You have to mix. But at the same time, you have to gel with other people around you, with the community, with the admin staff, with nurses, because you get a lot of information, a lot of insight from mixing with these different people in the community. So thanks for sharing that.
Senior nurses will really teach you a lot. They will guide you. Go talk to them, listen, just watch what other people are doing. I always say, if you want to rise in life, look at the smartest guy next to you, see what they're doing, and just copy them and make it better, make it in your way. And you have to mix with people. In the evenings, sometimes we go out to a pub or we are meeting in a coffee house or something. Go meet people, talk to them. And that is very important.
Thank you. Thank you for sharing that. No, thank you. That's really helpful to mention what you mentioned just now. And this actually brings to my attention that from reading the news articles, from listening to you now, that the number of overseas doctors are increasing, like skyrocketing, especially in the last 2 years. And what I'm hearing from them is they're getting difficult in applying even to attachment. You mentioned that they should get attachment, clinical attachment, but they're actually finding it very hard right now to get attachment, let alone applying for jobs. So what's your advice for them on how to apply for attachments? And then we'll ask you again how to apply for jobs and what to look at in the application form.
Let me start by saying that there are many resources which are available for foreign medical graduates. The Royal Colleges give a medical training initiative, MTI, which is for 2 years. And then, of course, they ask you to go back, and work in your own country. But there are other. British Medical Association BMA webpage for foreign medical graduates gives quite a lot of information. Our previous trainees now for some time have started their own Facebook and website where it is soft landing, page. If you read there, these are all foreign medical graduates, and they will tell you, what resources are available. For NHS careers also explains quite a lot to you. Sure. The clinical attachment is difficult. First, I'll tell you why it is difficult. It means we are all busy. And then if you take a clinical attachment, somebody comes up after 2 days, 3 days. Your clinical attachment was standing there and this happened. There is confidentiality issue, this and that. So people think, oh God, what I've got into. So sometimes people are reluctant to give, clinical attachment. Some consultants will happily give, some won't give. But that's the world. You don't get everything everywhere. You have to go hunt for it, find relationships, find your clinical attachments. Once you've done that, I must tell you, for one job advertised, we get about 200 to 2,000 applications. Wow. And I must tell you, you must be applying somewhere, because this looks like artificial intelligence bots. The CVs are same almost. And then our medical staffing reduces it to 70 per job. So a human being, a doctor consultant, has to go through those 70 applications. Now you can imagine, shortlisting, how difficult it becomes.
Yeah.
Many of the CVs for a pediatric job, and because you make a CV, you're sending to hundreds of jobs. You probably don't see it very well through, what you're sending. It is written that I want to become a general surgeon. So what my advice would be, first look at the job and specify that you want to work for that job. So it is very important that you show interest. I want to be a pediatrician. I want to be a neonatologist. I want to do respiratory. So for specific jobs, mold your CV like that. And then for that particular job, you must show your experience. You must have done experience. It's not that you passed your medical college, you did 1 year of internship. Maybe you've done more than that. So gather all your information specific to the job. So put it out in bold so that somebody can see it, and then say why you are interested in this job. So say these things. Also, just remember, some of the cities are oversaturated, for applications. London is oversaturated. It's expensive to live in London. Go look at all other places. It's not bad. Diversity is there. So don't think that very English-speaking, a wide population is not going to welcome you. They all will welcome you. They all know, that foreign medical graduates have come here and they're adjusting to the life. They're very kind people. So don't worry about that. Go apply where there are not so many applications to single job. And then remember, it is chance and luck. Sometimes you have to be at the right time, for the right job. Sometimes we want to look for a candidate who's doing clinical attachment with us and we just like them. They're so good. So we will tailor the job to them and we like to give them the job instead of then advertising and then getting it. So this is the way you can get in.
True. So that's very insightful. So what you're saying here is attachment is a key to make a good impression as a doctor and make sure you utilize it the best possible way. But if I ask you, what's the things that they should avoid doing in attachments so they don't get on the wrong pages?
Yeah, there are a few things. First of all, I won't say that clinical attachment is vital. It means if you don't get it, don't get frustrated. Maybe your CV is very good and you can do it. But once you got the clinical attachment, you are a doctor, right? The only thing is that you're not GMC registered. So we don't want you to touch patients, examine patients, or do things. But that doesn't kill your knowledge and curiosity. Ask when you're with a consultant. Think of, how you can have a good medical discussion. Talk to your registrars, talk to the SHOs, tell consultants, I want to take this medical history. They will always allow it. We will introduce you to the parents saying, this is a foreign medical graduate. They want to take your history. Do you mind? Children won't mind. Parents won't mind. Go take a good history. Present it. When in the morning handover comes, when the night team is presenting, pick up a child which you have seen, in which you made a differential diagnosis, in which investigations were sent, and then say, this is my presenting factors. Then next day, don't sleep over it. Go chase the results. Find out, tell others. Even your registrars will appreciate that, and they will tell the consultant that this Mr. John has done everything, or this person has done everything. And this is a brownie points. Then get into doing something for the unit. Unit is giving you clinical attachment for a month. Do something for them. What can you do something for them? Look at the guidelines. Maybe you have more knowledge. You want to change them. Do a little audit. Maybe patient satisfaction, parent satisfaction. Is there a playroom? Are there enough toys? There would be many things if you look around, scientific or non-scientific, which help a unit to progress. Show your interest that you really want to learn. You really want to do something. I think this is very important, and make friends with everybody.
Yeah, no, thank you. It's really, really insightful. You saying that, talking to many doctors who can reach out to me for mentorship, they always say they're really struggling to get a job. And it matters what you've said, that there's so many applicants, but how to make their CV stand out and how to make their application stand out.
See, first of all, you can't lie in your CV because one can see through. If you've done 1 year, 2 years or something, you can't say that I'm super specialist in that. But in your medical career, you always have done something towards that particular specialty where you want to work. Pull it out. Nobody has got time to read your whole CV. So pull it out in bold. If it says that you're applying in pediatrics, say you worked with children, you worked in this place, you worked in India, Nigeria, somewhere. You worked, there were 50 children ward, and I used to go around. I've learned so much. I've seen these illnesses. So talk about those things. Talk about that you have read research papers. Show your keenness. So your CV should be modulated to that. So that means every time you apply for a different job, you'll have to modify your CV. I'm sorry, the one standard CV,
Of course,
doesn't work.
Doesn't work.
Doesn't
No,
work.
definitely. Even in the corporate work, not medical only, you can't just have one CV because every specific job is looking for something specific. So you have to give what they want in the CV.
And the other thing is, if you have got anything additional, have you done a diploma? Have you joined a master's? Have you done anything extra? These are all little things add on to these things. So I know it's difficult. You come from your country, you're still struggling, you want a job, you want to earn some money, and live with your family. It's difficult, but these little other things, they help
boost your CV, definitely. So what would you say to the newly arrived who are applying for FY1? So they haven't got any medical background, they haven't got any master's diploma, they just finished internship where they had their primary medical qualification, and then come here for FY1 job. What is the best way for them to shine through in the CV and application?
There are two ways of applying to foundation years, which are foundation year 1 and 2. All UK medical graduates after passing out have to do 2 years of foundation program. Colleges will like you also to do a foundation program. You come here. So there are two ways. One is you apply directly and see if you get a job. Otherwise, the colleges sponsor you, under the MTI scheme for the foundation year. And if they sponsor you, then you may not have to give PLAB, but you confirm that, because I'm not very up to date on PLAB requirements. But if college, then you get sponsorship GMC registration, and then you learn about it. Now, foundation years, you move around. You see many specialties. It's not in one specialties. So you may move to surgery, to ENT, to pediatrics, to cardiology. So you will choose where you want to move around. In FY1, it's very important. You can shine in any role. That is what I believe. Never think that you are the junior most doctor, that you can't change the world. You can change the world. Take a good history. This is very important. Make simple diagnosis. Commit yourself that I will do these investigations. Then go justify why those investigations are necessary. People will start believing you have computer skills, because no longer we are believing in handwritten notes. The whole of NHS almost has become digital. Nowadays means people are very savvy in computer, but learn the system. Go sit with a receptionist or a secretary. Say, please, beg, to give you 1 hour, 2 hours. Learn everything. There are induction programs, attend induction programs. And then there are many other soft landing and BMA. They're doing induction programs. So go learn about the induction program so that you know. So remember, applying for a job is a skill. Getting the job is a skill and a luck. But once you got the job, to progress further, you have to outshine.
Yeah, thank you. Thank you for elaborating on this. You mentioned softlanding.org. This is the website. We will highlight it in the for all the viewers so they can kind of follow. Thank you for sharing this website. It's what do you call it? Softlanding.org. Yeah. Softlanding.org. Okay, and then you put it down. Yeah. Okay. Thank you. Okay, so thank you. Thank you for elaborating on this. I think it's really helpful to understand these points, that there's a hope for them to tweak their CV and for them to work in the system as a FY1, but still make some changes. This is really helpful. But once they've come to work in the UK for the first time, there are cultural differences between working in the NHS and working anywhere else in the world. So what are some of the unspoken NHS cultural expectations that overseas doctors often overlook, but are essential to success in their role in the NHS?
It's slightly overwhelming when you come and work in the NHS. You are exposed in a minute to everybody. You're not working alone in a room. The nurses, the parents, the doctors, the seniors, they just know. It's hard work. I don't think it's harder than the countries you come from. So the still patient numbers are quite long. You have to spend time with each patient. There was a time when the waiting list was less than 4 hours in the emergency department, but now it is getting longer and longer.
Yeah, much longer.
We can't deal with all the work. It means the workforce gets tired, but still we have to do the job. Now, it's important. There are some things, about how you address parents, how do you address children. This comes to fore very much important. You have to give respect to them. You have to be friendly with the child. And then there are cultural differences. But remember, I don't think they should inhibit you in working in this environment, because everybody is trying to help you to become better. And the simple reason is, if we all are better together, we will give a better service to our patients and parents. So don't get intimidated, that you're in a new situation. Once you're on the ward, you will become better. But remember, the mentors are there for you. I'll give you an example. European working and UK working is different. UK, India, America are same, but European working is difficult. I had a postgraduate from, Greece. She was very good. So we gave her a registrar job. The moment she came here, within 5 days, she said, no, I want to go back and I want to resign from my job. I can't do it. So she was European, but she found it very difficult. I was her mentor. I said, why? No, please, you come and talk to me. So I propped her up for another 5 days only. She again resigned, and she just wanted to go from hospital to straight to the airport. I said, listen, sit with me. I spent 4 hours in the evening with her. She said, my whole confidence is gone. I can't deal with it the way you guys deal and the way you do. I said, look, you are end of the day doctor. Okay, I'll do something from instead of being a registrar, because registrar, there is an SHO and then registrar mid-grade level and then a consultant. So she found it difficult to talk to the consultant about various things. When consultant asked, what is your diagnosis? She found it difficult to express. I said, no problem. So I said, I'll take you at its SHO level. So work till you are confident. She worked at SHO level for 2 months. Then time came to make her registrar again. So the moment she again panicked. I said, look, I'll give you another thing. I will be on call with you. It's immaterial if there is another consultant. I will also become unofficially on call with you. You want to say something else, pick up your phone, talk to me. And once you sorted your talk, then talk to your consultant. I told others she will talk to me first. She did wonderfully well. She was a very good doctor. She rose to a very good senior level. She's a consultant and she's very happy. And I'm in contact with her even now. So we will support you. Don't worry. There is a support. Don't panic.
Excellent. Now, thanks for sharing how you actually have helped someone, because this actually can change the whole world for them. Thank you for sharing your insights on how you've helped many doctors. And this is really, really helpful. But one thing I believe they need help with is understanding diversity, because this word means a lot in the UK, but doesn't exist in many other countries. And when they come here, they don't understand what it means. And it means different ways, something for them and something for the system and something for the culture. So if you could elaborate on this so that they understand what does diversity means and work in the NHS and the UK means.
Diversity basically means accepting that we are different. Everybody is different, ethnicity is different, we speak English in a different way, but accepting it instead of criticizing it. UK has moved a long way in this. In the NHS, we are diverse. We accept the way you speak, the way you talk, the way you dress up, everything is acceptable.
Sure.
Yeah. So don't worry too much about it. If you're working in the bigger cities, you won't even notice that you are a different ethnicity. But if you go to smaller towns where there is basically English population, Margate, here, there, I don't want to name all the cities here, the population could be all English, all whites. although it occurs rarely, but even then, when you workplace, you're fine. I'll give you an example of a recent, registrar who went on to work in such a place. So she was laughing about it. So they're Nigerians, both of them, and their two children are the only black children in the whole of the school. But interestingly, everybody else doesn't want to make them feel bad. So everyone is looking after them. So those two black children are the most important children in the whole school. Okay. So this, don't get daunted by this thing. So move to other cities. You need a job. Get a job wherever it is available. Don't look for excellent centers. NHS works equally everywhere. Whichever hospital you're working in, you can very easily give membership exams. You can pass. You can then later on apply for training numbers. So there is a good future. So, but don't be very choosy. Just get a job wherever it is available.
That's really helpful, because I think now you've set a priority for them is find a job anywhere. Don't be intimidated if you don't have that diversity in any place, because you will fit in and you'll find your way. And actually, people are very kind and they will look after you. Yeah. So don't be intimidated. Just focus on getting the job and don't stick to where you find people who are like you, because we are all humans. We're more comfortable when I find someone from my background, my city, my country. But people moved from everywhere in the world. They came out of the comfort zone, and then they want to go back to the comfort zone, finding people from similar backgrounds. And what you're saying is, and what I'm supporting as well, is you need to come out of your comfort zone. Make sure you concentrate on finding the job. Getting the first job is the most important thing. Find it anywhere and make sure that you are going and breaking the shell, leaving the people who you know to get your first job. Is that right? Do you agree on this?
Absolutely.
Yeah, definitely. Right. Thank you for this. Okay. So I wanted to ask you, what is your advice on building good relationship between colleagues at work? And we've talked about cultural differences and people are accommodating, but you must have got some tips for them to say how to build a good relationship, how to communicate better, how to be a person who will fit nicely in the team.
First of all,
especially with nurses and support workers as well, especially with nurses and support workers.
First of all, remember, when you're on the floor and doing your job, don't leave anything for others. So don't leave your work unfinished and telling people, oh, you do this, you chase this. Complete your work. You have to prioritize. If you're working for 6 hours, 8 hours on the job, you cannot say that I left so many jobs. This means your timekeeping is not good. You must have a good timekeeping, You must have a diary. You must not forget things. So remember, whatever way you want to do. You want to do on a computer your list, or you want to handwrite on somewhere, you want a sticky label. But remember what works are left and what you have to do. Meet people with a smile. A smile begets friends. Go sit down with them and ask them, can I help you? May I help you? Is there anything I can do for you? People won't give you work, but they'll feel very happy that you're asked about them. Don't always talk of medicine. People have their families. They've got their own problems. Some days they will be in a good mood. Some days they won't be in a good mood. Go talk to them. What is wrong with you? Why are you not smiling at me now? They may not be annoyed with you. They may have something else, They have some problem with the child in the school or something. Sure. So when you talk to them, you become friendly with them. Sure. Even when you're talking to parents or something, and if you're laughing with a child, the nurses note these things, Go sit down with the nurses. Go talk to them. Understand how they work. You have written an order, give this and this medicine to the child. But what things they have to go through, Ask them, do they need help? Do they need anything? Look at their ward structure. Are they littered around everywhere? It's not a clerk's job to pick up the, paper from the floor. You could do it. So just remember, mix with people, talk to them, smile at them, share a cup of tea or coffee with them, and share their everyday sorrows and happiness.
Thank you. Thank you for elaborating on this. And one of the things as well I always recommend, and when I'm talking to the people I'm mentoring, is you have to find a way to be interesting and get interested in people, because when you are interested in people, then you become popular and people will like you. Because as you said, if they look unhappy, if they look different than how you've known them before, it's nice to ask them, are you okay? Are you feeling, how are you feeling today? So you could help and also get interested with their life as well. It was not only about medicine and work, it goes beyond the life in the hospital, it goes in the life in the whole world. So yeah, I totally agree. But once they've established good relation and they're doing their job, the most common mistake I see with overseas doctors is they are lacking good documentation. So they don't document accurately, or they don't do good documentation at all. I'm not labeling everyone, but some of them. And they struggle with handover. So what's your nuggets of advice to them on how to do proper documentation and handover?
First of all, don't write pages after pages. No one is going to read it. Be succinct, be short, but it should tell everything about the patient, They look unwell, they look well, these are very simple things. You have to document everything. Remember, whatever you've written, there will be 3 subsequent teams who are going to come at different times and read through your notes and see, does this explain what the presenting complaint was? Because later on, everything may change. So it is very important. So document everything system-wise, general examination, systemic examination, your provisional diagnosis, what you're doing, what investigations you awarded, what are you expecting, something to happen tomorrow. So write them very carefully. And when you must in the morning present somebody, because that's really very, very important. Or even on the ward rounds, you say, I've taken the history and I will present. Have a scheme of presenting the thing. What was that? People use many acronyms, SBAR, this, that,
whatever,
Yeah, so what was the presenting complaint? That why this child came? Then what were your findings, clinical findings? And why you say this child has got this medical problem? And how you have structured your investigations? And then, of course, rest of the team will talk. Somebody may say, I don't think so, this is right. Or somebody say, oh, yes, correct. It does not matter, correct, not correct, but the way you present and the way other people pick up, we will reach a conclusion. We will make the right diagnosis, but your initiative and you presenting is very good. You must teach, nurses or something. You must you must take a part in the audits, in the teaching. You have to be on the go all the time. This is your time to learn and develop. You cannot enjoy outside. I'm not saying keep working all the time.
Of course.
I'm mentoring a senior doctor from Nigeria who just is giving exams and is alone. His wife is not here. He's studying whole day. So when I'm mentoring him, my first question is not how much you have studied or worked hard. I ask him, do you have friends? Do you go to pub? Do you go out meet with friends?
Fine, yeah.
Do you have any socializing? Did you see a movie? So this is my mentoring for him because he needs that. The rest of the things he's doing.
Sure.
So you have to look at holistic approach to your life. Don't get loaded up in one thing.
No, thank you for sharing that. And now you as a senior doctor, what would make you take junior doctor seriously? Overseas doctor seriously?
See, if you are on the floor and I'm on call with you, I have to be comfortable that the decisions which you're making are the right decisions. It's very important. Remember, consultants are not on the floor. In some units they are. In obstetrics, in A&E, consultants are on the floor. But vast majority of specialties, consultant on call are from home. You are picking up the phone and talking to them. We have to have confidence that when you tell me a child is struggling or child is this, I should believe. I see through your eyes. So what you're telling me, I'm seeing through your eyes. So I should be comfortable and confident that you're making the right decision. You're not going to miss, and some mishap is going to happen in the morning. So this is what we are looking in you. Whatever you do at whatever level you are, from foundation year to SHO and to a senior registrar or a doctor who's going to become a consultant, the level is different. We know it. We will ask the questions accordingly. So we are not going to put you in trouble, but when we are asking questions, we need clarification and we want truthful answers to that. So this is very important. Sometimes we say, oh God, I don't know what he's talking about. I better go in and have a look myself. This is where.
Okay. So be clear in communication. Make sure that you are clever or getting clever in how to pick clinical science, discuss it in the right way, present it in the right way, to gain confidence of your seniors and your team around you. No matter who is the team, nurses, doctors, senior engineers, everyone, right?
It's not difficult. Don't think that I'm making things difficult. It's very simple. You can very easily do it.
But you said that's why you say it's simple. For them, it's really difficult, because I've been talking to many overseas doctors recently, and they found it really difficult, and they're really struggling with how to cope with the system and understanding these differences. But what do you think the NHS should do today to help in mentoring? Because you said there are many mentoring programs, but for example, in many hospitals I've asked in, and where doctors are talking to me from, they don't have mentorship program. And I believe it's shared responsibility. So the doctor should find for someone to mentor him or mentor her. And NHS should also provide mentorship program in every single hospital dedicated to help overseas doctors that are really numbers skyrocketing in the last 2 years, to help them. So just want to take your view on this, and what should NHS do better right now to help these overseas doctors settle in the UK with confidence.
Whenever you demand something that this should happen, first you have to look at the resources available, right? Now, there are many views. Your view is you're a foreign medical graduate, you want to come to the UK and you want to work here and you want to be successful. Very good, nothing wrong with it. There's another view that is UK looting all these other countries from the very special doctors and making them come here and work. So what will be left behind? So there is this aspect also. The other thing is how busy we are. No one is allocated resources to it. No one is funding this money, So many of the people, for initial bit, they're doing on their own goodwill. So in mentoring and other things, there are induction programs, so you can join induction programs, when you enter a job. When you have entered a job, it will become our responsibility as senior consultants to nominate a consultant who has FY1 and 2 under them. They've got SHO under them. They've got registrar under them. So we will take 3, 4 for each one of us. We'll meet them. We'll look at their CV. We'll look at their needs. We'll put the training program according to them so that they progress. But vast majority who have not had a clinical attachment, who don't have a job, right, the resources available are what I've told you, so you could look into those resources, but vast majority, we cannot do mentoring for those people who are not in the system.
Sure.
It's impossible.
Okay. And I'll take your view on this. And I was specifically asking about doctors who already came to the UK working as doctors, but they're not getting enough mentorship and support. But as you said, there's limited resources, but it's a shared responsibility. So if the doctor, he or she thinks that they need mentorship, they should ask for mentorship. They should actually go and ask consultant doctors in the hospital, outside the hospital, privately or whatever, to be able to get the mentorship they need. Because one single mistake could get them into lots of litigation. And I'm sure you've seen the GMC website. And if you look at the list of doctors under investigation, if you see 10 names, 9 names will be overseas doctors. And this tells a story. It tells that there's a problem there. And there should be a way for the NHS to recognize this. I'm sure it's beyond our capabilities. We're just, voicing our concern and voicing our recommendation to happen. But what I'm trying to focus on today and in my program is that mentorship is shared responsibility. It's between NHS to provide people to mentor and for doctors to look for mentors themselves inside hospital, outside hospital. And I'm sure you agree on this, that mentorship is really important. Yeah.
Remember something, if you're in the job and if you feel that you're not mentored enough or training opportunities are not there, speak up, talk to somebody. There are many people, it does not matter whether you talk to 1 or 2 or 20. Go say that I need this. Unless you say it, many people may not understand, that you need it. Yes, you're right. That mentorship should be there. We should guide them. We should provide training opportunities. If it is not there, talk to people, talk so that they can understand what is your need. If you are inhibited in saying, if I say to something, I don't know this, they will think that I'm not an experienced doctor. It does not happen. You say what you don't know. We will then try to help you. But if you don't say and hide your weaknesses, one day it will come forward and then there will be litigation.
Sure.
So speak up.
Now, thank you for sharing this. I'm actually benefiting from what you're saying right now, and some of what you're saying actually make absolute sense. So really, really value your input here. Along your journey helping junior doctors in from many different countries, what was the main act or thing that they've done that really impressed you?
The many things which impress you. Your knowledge impresses us. Your way of behavior impresses us. Your truthfulness impresses us. Some people have a habit of not talking to anyone and being quiet. Well, it may suit their personality, but it doesn't suit everybody around you. Many of the doctors, they outshine. We can tell them, when we're talking, remember something, there is a Bush telegraph going on between the whole unit. So we talk about each other and we say, oh, that person and this person and this person is, and then we say, oh, we need some friends for that person, because that person needs to talk to somebody. We'll go to the nurses, come on, go talk to that person. So we see these things in interviews. When you're appearing for the interview, there's no need to be nervous about it, because interview is to give you a job. If you're nervous, you will never get a job. So be confident about what you're answering. Look into the eyes of the people. They're asking you a simple question. Nobody is going to ask you a difficult medical question. What will you do? Investigations for TB or something. It's general question. And you can answer them well. I'll give you one example. There was a whole UK registrar's interview where I had to appear. I didn't know there was an interview going to happen, because they were taking all these foreign medical graduates. They wanted to re-interview them. And I was in the pediatric intensive care unit and I was working. Thank God that day was not my hands-on job. I was wearing my jacket and things. And then consultant called me, can you appear for interview in half an hour? So I said, okay. So I went to Central London. There were 22 people who were interviewing. And when I went there for the interview, I knew I have got a job, but my continuation of the job depended on that interview also. So the Royal College president of pediatrics picked up my experience in Saudi Arabia. And he asked me a question. I'm sure this question was there to destroy me. Sorry. He asked me, why did you choose Saudi Arabia for your medical training? Now remember something. I worked there in American hospitals. I could have said they're very good unit, very good this, and tried to blah, blah. But I didn't, because I didn't go to Saudi Arabia for medical training. So I looked at all of them. I said, sorry, I didn't go there for medical training. I went there to earn money, and I earned loads of it. They just laughed and laughed and laughed. After that, they didn't ask me any question, Midnight, my consultant rang me. I said, oh God, I lost the job because I said that stupid thing. He said, Rajiv, you're the first one in the whole list. What I'm saying is, talk, be confident. You are a doctor. You may not be English or you may not be UK trained, but you're still a doctor. You learned enough. You worked hard enough. Have confidence in yourself. Express yourself. Talk to people. Listen to them. Listen right and left. Look, people are working, and just learn from them. Go to a consultant. Speak up. I need more help. Please teach me this. I don't know where to go. They will guide you. But if you're quiet, nobody will come to you.
That's true. Thank you for sharing this insight. I think it's very important that we highlight this overseas doctors, because, as you said, they feel isolated, they stay quiet, and they think this is the way they handle it. And for the interview, they should stand out in the interview. They should make sure they prepare very well and answer the questions in the way that will make them stand out in the interview. Because, as you said, there's hundreds of applicants. And if you don't stand out, there's no chance for you to get the job. But let me ask you something different, changing a bit of direction here. So I'm sure as a consultant and a registrar, you've faced so many difficult situations. What was your comfort food that you go to? Or what would you eat to make yourself, feel better? It's like when I'm stressed about, I would eat chocolate. I like chocolate and biscuits. What's your go-to food when you have a stressful moment in your career?
If you're in a job which is very hard working, with a lot of stress involved, it may be emergency medicine, or you may be in the theaters, or you may be somewhere else. Just remember, this is doctor's way of work. I won't have my coffee. I won't eat lunch. Let me just postpone. I'm working. Never work hungry. Have a break. Go have your cup of coffee. Go eat something. We purposefully tell people, stop work, go eat something and then come back. When you're hungry, you'll do a mistake. When you're hypoglycemic, you'll make a mistake. When you make a mistake,
no one will forgive you. No one will forgive you.
Remember that, because some things happen by your good intentions. You've done something and then everyone will support you. But if you've done a stupid mistake because you were hungry, you were hypoglycemic, no one is going to save you. So well fed, well hydrated, have your coffee, have your breaks, and then work hard.
What about chocolate? You don't eat chocolate when you're stressed about it?
Good chocolate, anything.
Yeah, that's true. Right. So if you had the chance to work something else rather than being a pediatrician, what would you work? Even for a day?
Yeah, not for a day, probably for many days I could do. I like gardening. I like to grow vegetables. And my biggest worry is all my plants get fungal infection and I don't know how to treat it because I want to eat that fruit. So I don't want to spray, some chemicals on them. But you all should have something else to do. Don't become a boring doctor.
Sure.
Do something.
Be unique.
Yeah.
Stand out. Yeah.
And don't get depressed. If you didn't get a job 1 month, this month, that, I know there is financial pressures, but you will be successful if you put your mind to it.
Definitely. It takes time, but at the end, people usually manage to find the job if they're doing the right steps forward. Right. So with your experience, what is more challenging for you to handle on day by day? Is it toddler or teenagers? And be honest.
Toddlers are easy. Toddlers are crying only. And when you look at them, you don't need a history. You know where the problem is. Teenagers don't talk to you. They don't tell you what is suffering from them. When you tell them to remove their jacket, you will see lines on their arms and things, They don't tell you what friends they have. They don't tell you whether they're addiction or something. They will mold the history accordingly. So you ask them, they will hide things. So with teenagers, you have to have a different approach. You have to talk to parents, to teachers, to families, maybe sometimes their friends. So it is difficult. There is hardly any teenager who will come and tell you, I do this.
Sure.
Help me. But toddlers just cry and you get used to crying children. It's okay.
You get over it. So toddlers are easier, right?
Easier.
Great. Mr. Sood, thank you so much for your time today. And thank you so much for your valuable information. I personally have really got lots of values out of this. And I'm sure all the viewers will appreciate this and will thank you very much for your time and for your information. This was such a rich and heartwarming conversation with you, Dr. Sood. Thank you so much for your time and for your wisdom and for your kindness. And you've reminded us today that support, mentoring, and empathy can change the path of any doctor's journey. They just have to be persistent on doing the right thing until they get the job. So to everyone listening, whether you are just starting or deep into your NHS career, remember, you don't have to do this alone. Always ask for help. Help is out there. Mentors like Dr. Sood exist, and communities like ours also exist, and we're all here to help you. If you found value of this episode, share it with other friends or colleagues who might need to hear about it. And if you'd like to hear more inspiring voices, please subscribe to this channel and leave a review and join us again for the NHS Navigator podcast on the NHS Success Circle. And thank you. Thank you for watching.